Thank you very much. Now, as many of you are no doubt aware, trees provide a wide range of benefits, urban trees in particular. These benefits range from the intuitive benefits, such as reduced summertime cooling costs, to less intuitive benefits, such as lower crime and even increased social cohesion. Why then, in this talk, am I focusing exclusively on the health benefits? Well, there's really a clue in the title of my talk. Urban trees are quite literally a matter of life and death, and I do mean this literally, and hopefully I'll prove this to you over the next 45 minutes or so. I don't mean life and death as some sort of overwrought metaphor, I mean it quite literally. And in my view, the health benefits of urban trees are the most important benefits that they provide. It's not even close. Now, unfortunately, these health benefits are not well understood. And the problem with that is that they're not being properly included in our urban forestry decision making. We're not taking them account of them as much as we should. Now, this is a major problem, and it's going to lead to significant underinvestment in urban trees. And in consequence, our cities, they're going to be less green and less healthy places to live. Now, sometimes I hear people talk about urban trees making a city more livable. And while I certainly don't disagree with that, trees do make a city more livable. I think that really sells trees short. What I think is that urban trees make a city survivable. And I think that's an important distinction. We're not designed to live in grey, noisy, polluted places. We just aren't. And trees can help attenuate some of those negative effects of urban living. There's an old adage in environmental economics, and that's where I come from, is if you can't count it, then it doesn't count. And what my research attempts to do is to count these health benefits. And I hope that some of you can use my results to better advocate for urban forestry and ultimately get more trees in the ground, as well as helping to retain mature canopy. And that's at least as important as the tree planting, the maintenance of that mature canopy. And I'm going to talk more about that later. I really have a very simple message for you, and that is trees are far more important than even the most ardent tree advocate in this, I was going to say this room, this virtual room, believes. Um, Indeed, another way to look at it is those of you who work in urban forestry, your jobs are far more important than you realize. And really, you should be considered part of our healthcare industry. Indeed, I believe that urban trees should be considered an essential part of our public health infrastructure. Now, before I talk about the results from specific studies, I'd like to talk about one of the problems that can come up when you do research on the health benefits of trees. I do what's called observational research. So that simply involves looking at the world and trying to identify patterns in data. You collect data, but you don't do anything. You don't intervene experimentally. You don't have a prescribed fire. You don't inject an experimental drug into somebody. You just observe the world. And one of the problems that you get if you're looking for patterns all the time is you start to see causality where it doesn't really exist. So you start to believe that NFL teams with more vowels in their name are more likely to win the Super Bowl, or baseball teams with more white uniforms are more likely to win games on a Tuesday. Now, it's not to say that those aren't true. Perhaps baseball teams with white uniforms are more likely to win on Tuesday. Unfortunately, the Dodgers have white uniforms and they're winning a lot of games, so that might be true. It's just that it's the white uniforms aren't causing them to win, right? Maybe having Shohei Ohtani hitting leadoff, that might be more to do with it. So there's no true causal relationship there. So how do you stop yourself from seeing causal patterns that don't really exist? Well, one way, and a really good way, is to have a solid reason for thinking that two things are linked before you ever collect any data. Don't just start collecting data and looking for patterns. That's data mining, and that can lead to all sorts of problems. And in the case of trees and health, is there reason to think that there's a link, that trees could causally improve health? Or another way, how could trees improve health? What might be the mechanisms linking trees and health? And really, you don't have to think very long to see that there are some pretty intuitive links. For example, we know, hang on a second. having a little problem getting. There we go. There we go. We know that trees can absorb air pollution, and we absolutely know that exposure to air pollution puts you at a risk for a whole range of diseases. We also know that if you were to go outside now and sit under a tree, your short-term markers of stress would go down, your blood pressure would go down, your salivary cortisol would go down, your heart rate would go down. Now, some of that might be just from the stress relief of not listening to me, but some of it, I think, would be the trees. We also know that people who live in greener neighborhoods have more social connections. And we know that social connections are profoundly important for your health. Being lonely will kill you. If COVID taught us nothing else, it is about the importance of those social connections in the neighborhood. And trees are one of the things that can help foster those relationships. We also know that people who live in greener neighborhoods are more physically active. And Lord knows we've all been told so many times that exercise is good for us. And then finally, just for this list, there are in fact several other important mechanisms, but we know that trees can cause shade and reduce temperature. And we know that during heat wave, hospital admissions and deaths increase. And tree shade is one way that can attenuate some of those negative effects. So all these mechanisms tell us it's reasonable to hypothesize that trees could cause improvements in health. Not that they will, but it's reasonable to think that they could. So as we've sort of cleared that hurdle, let's go back now 14 years into the mists of time to look at my first trees and health study, which looked at the relationship between trees and birth outcomes. Now, why on earth would I look at the relationship between trees and birth outcomes? Why choose that particular health outcome? Well, the first reason is just a pragmatic reason. There's statutory requirements to report births in this country. So over 99% of births recorded. There's a lot of data on birth certificates, baby's weight, gestational age, demographic information on both parents. So the type of things that you need for what I do is very data hungry. So having those data is great. Second, and this is really important, there are plausible mechanisms linking trees and birth outcomes. So just as one example, we know that women who are more stressed or who are exposed to air pollution are at higher risk of adverse birth outcomes. And as I just said, trees can reduce both air pollution and stress. So there is plausible mechanisms linking the two. So I'm not saying right now, I can't say trees cause births, cause better birth outcomes, but it is possible. So let's go investigate whether we actually see that. So in this case, in this study, I looked at almost 6,000 singleton live births to happen to mothers who lived in single family homes in Portland, Oregon, which is my home base, in 2006 and 7. And we looked at two adverse birth outcomes. The first was just being born preterm. So that's, were you below the 10th, were you born before 37 weeks gestational age? And then the other was being born underweight. And we classified that as if your birth weight was below the 10th percentile based on your gestational age and gender. So premature and underweight were the two things we looked at. Now, even the most ardent tree advocate is not going to say that trees are the only or even the main reason that a woman has a healthy or an unhealthy pregnancy. There's a whole load of other things that we know from past research can affect that. So demographics matter. So we took account of income, of a mother's race, of her education, of both the mother and the father. We account for previous births. We know if a woman's had an uncomplicated birth in the past, she's more likely to have an uncomplicated one in the future. We looked at insurance, public, private, or no insurance. We looked at the amount of prenatal care a woman received. We looked at distance to stuff, so good stuff like parks and public transportation, bad stuff like freeways. We even looked at the characteristics of a house. We thought perhaps if a house had air conditioning, it might make a pregnancy less stressful in the summer, for example. And then finally, we looked at crime around a home because we know that crime can be a stressor. So I want to really emphasize we account for all this stuff first. We held all this stuff constant. Then and only then, we looked at tree canopy in 50, 100, and 200 meter buffers around the center of each house's lot. So On the left, you have a high-resolution aerial photograph in Portland. And I should say, just for privacy reasons, these aren't women, the actual sample. They're just sort of randomly selected houses. And the green line is the edge of a house's lot, and the red dot is the center of that lot. And on the right, you have what's called classified aerial imagery. And you take that photograph, you break it into 1 meter squares or pixels, and then using a computer algorithm, you classify those 1 meter squares as either tree canopy, that's the green, or the not tree canopy, the sort of off-white. And then for clarity, I've only included the 50 meter buffers in this picture. So what did we find? Let's jump straight to the results. We found that women who had more tree canopy within 50 meters of their homes, so in these pink buffers here, were significantly less likely to have an underweight baby. Okay, well, that's an interesting result, but maybe it's a statistical oddity. Remember, this is the first study that had ever looked at the relationship between the natural environment and birth outcomes. Maybe it's a white uniforms on a Tuesday deal. And that's not the worst possible explanation. But an interesting thing happened, or several interesting things happened. I published this paper in 2011. In 2012, a friend of mine in Spain found that women with more greenness, and he measured this with satellite imagery, more greenness within 100 meters of their homes had higher birth weights, so consistent results. Then in 2013, a team in Southern California found that women with more greenness within 50 meters of their homes had higher birth weights. Again, consistent results. 2014, a team in Germany found mothers with more greenness within 500 meters of their homes had higher birth weights. Consistent results. And this next study is in Canada in 2014 as well. And this is an interesting one because I met the guy who's the lead author, and he told me quite candidly when he saw my paper in 2011, he thought, that's nonsense. That can't hold. He's obviously made a mistake. I'm going to do a paper to disprove his results. And he ended up doing a paper confirming the results because he also found that women with more greenness within 100 meters of their homes had higher birth weights. So that's an interesting case. This certainly isn't a paper that was blindly trying to confirm my results. Now, I could go on at really tedious length here. Since my original paper, there have been at least 30 studies have found a link between greenness and higher birth weights. Could one study be a statistical freak? Absolutely, it could. Could 30? Well, maybe, but it's a lot less likely. Let's stop here a second and imagine, I'm holding a baby, healthy weight baby in this hand and an underweight baby in this hand. The difference between the two might be a mother's exposure to trees during pregnancy. Wow, we're really getting at something fundamental about our relationship with trees and how that affects our health even before we're born. Now, the link between trees and birth outcomes is interesting. Oh, I should also say, if you're born underweight or premature, you're at much higher risk of dying or having health complications around birth. We know, for example, neonatal intensive care units are maybe the most expensive place in a hospital. The cost of caring for a single child can routinely run into millions of dollars. And we also know to some degree, being born underweight or premature puts you on a health trajectory for life. For example, people do less well in school, not everyone, but they're less likely to do well in school and less likely, they have lower lifetime earnings as well. So you end up getting put on a different trajectory through life before you're even born. And the thought that trees might be able to do something about that, I think we're on to something important. Now, the link between trees and birth outcomes is interesting, although I'm hardly, objective in that sense. But it does also highlight one of the biggest headaches when studying the health benefits of trees. You have what I call the nice tree, nice neighborhood effect. That is, in urban areas, neighborhoods with more trees are going to tend to be wealthier, whiter, and better educated. And we absolutely know income, race, and education are major drivers of health outcomes. Now, we know already it was well known that people who live in greener neighborhoods are healthier. That's not the question. The question, is it the trees that are making them healthier, or is it that they're wealthier, whiter, and better educated? Or is it some mixture of the two? That's really the question. Now, as I said before, we try and account for these things the best we can in our modeling, but we can never be completely sure that we've accounted for everything. And that sort of leaves you with a bit of a gnawing stomachache. And about 11, 12 years ago, I guess 12 years ago now, that gnawing stomachache, it kind of paid off for once, because I realized that I can flip my hypothesis on its head. That is, if trees are good for you, that's what I think, then killing them should be bad for you. Well, why is that such a grand revelation? Well, because it opens up some new methodological approaches. Because trees can die a lot quicker than they can grow. So if you are studying the health benefits of trees and you're waiting for them to grow, the problem is people move, they die of other causes. It's studies that would last decades, and they're very complicated. But if trees can die overnight, really, so you could see if there was a major change in tree cover in a short amount of time, it would be easier to study that relationship between trees and health. Also, a rapid loss of tree canopy might present a unique and valuable opportunity to sidestep that nice tree, nice neighborhood effect. Because at one point in time, we know that tree cover is correlated with income, race, and education. That's a known. And that's in different cities, different countries. It seems to be a sort of universal observation in cities. However, tree loss over time, that need not be correlated with these drivers of health. It could be, but it need not be. And if it wasn't, that would be a great opportunity to untangle that relationship between trees, health, and demography. You could maybe sideline the demographic drivers of health and be a little more sure that the relationship we're seeing is a causal relationship between trees and health. So, to do this, two things would need to happen. First, you'd need a lot of trees to die in a short amount of time, because just a couple of trees falling down isn't going to have measurable effect on health. And the second condition I alluded to is that this loss of trees would have to be uncorrelated with demographic drivers of health. Now, let's see. What could satisfy these two conditions? Well, for the first condition, given that you live in Illinois, you probably are going to get the answer to this question right. What could do it? Well, invasive pests fit the bill, and the nastiest in the last 20, 25 years has been this handsome little devil, the emerald ash borer. So I'm sure you're all intimately familiar with him. For those of you who are lucky enough not to know what he can do, this is a tree-lined street in Toledo, Ohio in 2006, and the same street 3 years later. So clearly EAB satisfies this first condition. It kills lots of trees in a short amount of time. It's killed hundreds of millions of trees, it might be billions by now in the US. So that first condition is great. But what about the second condition? Is the loss of trees to EAB correlated with race, education, income? To answer that, let's take a look at this little animation showing EAB as it spreads from Detroit in 2002 all the way out to Oregon in 2022, which is where I am. Now, when you look at this, ask yourself, can you imagine changes in race or income or education mirroring this sort of pattern? Not really. This is not how demographics change, and I've checked. So statistically, the spread of EAB is uncorrelated with changes in income or race or education. So that's great. So what that means is, if we find that EAB is correlated with changes in health, then we know that these health changes aren't caused by changes in race, education, or income. So that's great. Does that mean that tree loss causes changes in health? No, we're not quite there yet. I don't want to be clear about that, but the evidence of a causal link is a little bit stronger. And science is incremental after all. So, having found this unique pattern of tree loss, we then asked ourselves what health outcomes could be impacted. And we chose to look at cardiovascular and lower respiratory disease for a couple of reasons. One, they're really important. They're the first and third biggest killers in this country. And second, there are plausible mechanisms linking trees with cardiovascular and lower respiratory mortality. A lot of the mechanisms I talked about at the beginning. Stress, air quality, exercise, all of those things. And in this case, we chose to look at county level mortality. The black squares in this map here are counties. There's about 3,000 of them in the US. So we looked at county level mortality, and we looked at that from 1990 to 2007. So from 1990 to 2002, this is a long running period, no bug. The bug's added in 2002, and then we see what happens. And what we found is that counties infested with EAB had significantly higher rates of cardiovascular and lower respiratory mortality. And interestingly, this association increased in size and significance as an infestation progressed, because not all the ash trees die instantly when a first EAB flies into a county. No, it takes time. And as more trees died, more people died. So we saw a dose-response relationship between trees and health, which is what we would expect to find. We also saw, interestingly, a bigger impact in wealthier counties. Why would that be? Well, because wealthier counties are going to have more trees, better maintained trees possibly. So those are going to provide greater health benefits. So you take them away, you're going to see bigger negative health impacts. And that is indeed what we saw. And across 6 years and 15 states, we saw an additional 15,000 deaths from cardiovascular disease and 6,000 from lower respiratory. So that's an additional 21,000 deaths attributable to EAB infestation. So quite a startling result. Certainly I remember when I was in my office and I started to get these results, the numbers were quite startling. But when you get results like this, the temptation is to shout them from the rooftops, but don't do that. The best thing you do when you get really interesting looking results like this is quietly shut your office door and try and disprove them. If you manage to disprove them, then you're going to face private disappointment. If you release them prematurely into the world and somebody else disproves them, then you face public humiliation. And I've experienced both, and one is definitely worse than the other. So how did I try and disprove my results? Well, I said, okay, let's look at the relationship between EAB and a cause of death it couldn't possibly impact. And what we looked at was accidental death, because, beetles can't cause car accidents. That would be silly. So what we call a negative control, because sometimes negative results are as important as positive ones. You don't want to see a relationship where there couldn't plausibly be one. It goes back to that right at the beginning of the talk when I was talking about the necessity of having that plausible mechanism. And in this case, there wasn't one. And we didn't find a link between EAB and accidental death, and that was great. So in summary, we found that EAB was associated with increases in 2 causes of death it could plausibly impact. That's cardiovascular and lower respiratory disease. And it wasn't linked to a cause of death it couldn't plausibly impact, and that's accidental death. Now, since I did the original research, several studies have confirmed some of my findings, and they've also shed some light on the mechanisms linking the natural environment and health. So, for example, a few years ago, this study looked at whether EAB affected the probability that someone engaged in outdoor recreation. So remember, exercise was one of those possible mechanisms. So we're just going to concentrate on this figure on the top left here. So the vertical axis there denotes the probability that somebody engages in outdoor recreation. And then the horizontal axis there is time. And here is where EAB infestation arrives in a county. So you see, as soon as EAB infestation arrives in a county, you see a sharp drop in the probability that someone engages in outdoor recreation. And that drop persists although it decreases a bit, it persists for 5 years. And this suggests that people reducing the amount of outdoor recreation they engage in counties infested with EAB may be one of the mechanisms. Now, explaining these results to people without a scientific background can be challenging. It's fun often, but not without its challenges. And several years ago, a reporter from Wired magazine contacted me because he was writing a story about a different invasive tree pest, the polyphagus shothole borer. Say that one a few times quickly. And that had, at the time of writing, recently arrived in Southern California. So he was wanting to know whether this could cause health problems. Now, he was an interesting character, this reporter. He was a dedicated science reporter. There's not many of those left. He'd actually read my studies, which reporters seldom do, and he asked intelligent questions. So I was a little less worried than normal that he was going to make a big hash of explaining the results. But maybe I shouldn't have been quite so confident, because this was the article he wrote. As you can see, a tiny bit of the nuance was lost there. And my wife is a science writer, and when she saw this, she laughed so hard I thought she was actually going to hurt herself. So as you can see, getting that information across can be tricky. Although that said, I got a lot of interest because of this story, and people contacted me and asked me to give talks. So who knows, maybe the reporter was onto something. Now, I think the results from the EAB study are pretty compelling. Of course, I'm not objective there. But in the years since I did the study, I've wondered whether the opposite was true. That is, if killing trees is bad for you, is planting trees good for you? You would think there'd be this symmetrical relationship. However, to study the effect of tree planting, you'd need many years, realistically decades of planting data, because of the problem I talked about earlier, because trees grow so slowly. So you would really need lots and lots of data. And I didn't know where I could get decades of tree planting data. I tried the city in Portland, tried some other cities, and they just didn't have it. So I kind of half gave up on the idea of doing this study. And then just a few years ago now, I was talking to a colleague of mine who at the time worked for a Portland-based nonprofit called Friends of Trees. And just in passing, she mentioned that Friends of Trees had 30 years of tree planting data. So they had the address and the date where they'd planted 50,000 mostly street trees, some yard trees, since 1990. It's amazing. So for some reason, they just kept really fastidious records, bless their hearts. And they were kind enough to give me access to them. So a big thank you to Friends of Trees. I found generally in my research, almost all the studies requires the kindness of strangers. Somebody who's got no direct benefit from something from the study will go out of their way to help me. And I'll ask people, and I have no leverage over anyone. Like, you can say no to me and nothing bad happens. But luckily, in this case, they went out of their way to help me, and in other studies have too. And I hope that that's resulted in some good work. So they had 30 years of tree planting data. I wanted to get health data that corresponds to that. So I contacted the Oregon Health Authority, and I got access to census tract level mortality data. What's a census tract? It's a geographic unit which the US Census reports data. And in Portland, it's a city of 600,000. There are about 140 tracts, give or take, depending on how you calculate that. So they're roughly the size of a named neighborhood. So you can think of this study, we were just looking at what affects neighborhood level mortality. And we calculated two tree planting variables. Just the total number of trees planted in the last 15 years. That was easy enough. Or the number of trees planted in three age bands. 1 to 5 years ago, 6 to 10, and 11 to 15 years. Why did we break them into three bands like that, age bands? Well, because a priori we would expect that as trees got older and bigger, they would have a bigger impact on health. A bigger tree can cast more shade, absorb more air pollution, probably provide more stress relief, and so forth. And so we wanted to make sure that that's what we observed, because if we didn't, then maybe something was wrong there. So let's just jump straight to the results. Very simple model. And this table shows you how different variables in my model were associated with neighborhood level non-accidental mortality rates. And we looked at non-accidental mortality, which is typical in these studies, because, as I said before, tree planting or tree loss isn't going to affect accidental death. That's ridiculous. So we just took that out and looked at all non-accidental mortality. So the first thing we found is that neighborhoods were wealthier, had lower rates of non-accidental mortality. Not at all surprising. You see this in all health studies. Being rich is good for you. No question about that. We then found that neighborhoods where people were older had higher rates of mortality. Not bad, not surprising, as being old is bad for you. We found that better educated neighborhoods had lower rates of mortality. And then we looked at race, and this was not significant. It was mildly surprising, but maybe not so much for a couple of reasons. One, we already had education and income in the model, so that might, to some degree, explain some of the effects of race. Also, Portland's a very white city, so you just don't have a lot of racial variation. So from a statistical point of view, there just might not be a lot of variation in the model. Okay, so now to the variable we actually care about, tree planting in the last 15 years. What happened there? Well, we found that there was significantly lower rates of non-accidental mortality in neighborhoods where there'd been more tree planting. Now that's great, but how big is the association between tree planting and mortality? Because sometimes you can find relationships that are highly statistically significant, but the magnitude of the relationship is trivial. So, for example, if I found that planting a tree increased someone's life by 37 seconds, it would be a kind of interesting oddity, but it wouldn't really matter. Nobody's going to go on a tree planting campaign to extend someone's life by 37 seconds. So how big was this effect? Well, across 30 years of the study, Friends of Trees on average planted 1,638 trees a year. And we found that planting this number of trees was associated with 15.6 fewer deaths, non-accidental deaths a year. So that's not a trivial number. Another way to look at this is for every 100 trees that were planted, we averted roughly one death. I think that's quite a remarkable number. Now, let's see how that association between trees and mortality changed as trees aged and grew. So for this table, all we did is we said, okay, let's take that 1,638 trees, the average, and then let's wait 1 to 5 years after planting and see how many deaths were averted. And we found across the whole city, that was 11.6. Okay, that's good. But what happens if we waited a little longer, 5 more years? So there was 6 to 10 years after they were planted. Now 19.7. Okay, good. It's going up as we hoped for, as we expected. Okay, what happens if we wait 11 to 15 years? So the trees are turning into actual trees now. That's 23.1. So it's what we hope to see. As trees age and grow, the impact on mortality got higher. So this is just a very simple graph. So there are a number of messages, take-home messages, I think, from this graph. First, as I said, the association between trees and reduced mortality gets bigger as trees age. So bigger trees are more important for health. Not surprising, but it's good to see it confirmed. But what that means is that retaining mature trees is at least as important as planting new ones. And at the beginning of the talk, I said I'd return to this point. So maintaining mature canopy, very important. And in the context of EAB, for example, it would be best to avoid concentrated loss of mature ash trees. And it suggests that pesticide treatment could actually have public health benefits. So despite pesticides having some negative health connotations, in this case, they might actually improve our health. Now, as well as looking at non-accidental death, we looked at cardiovascular, lower respiratory, and accidental death because we wanted to compare our results to the EAB study. We wanted the results to be comparable. So first thing is we looked at cardiovascular disease, and we found that neighborhoods with more tree planting had significantly lower rates of cardiovascular disease. No question, very significant. We then looked at lower respiratory. That was a little less clear. At around the 10% level, there was a significant relationship, but not at the 5%. So not so clear, but it definitely was, for cardiovascular disease, it was a very clear relationship. And then let's look at accidental death. Remember here, we don't want to see a relationship. And we didn't. It was not significantly, there was no significant association between tree planting and accidental death. So that's great. So now let's just take a moment to consider how consistent the results are from these two very different studies. You had the EAB study, and now you've got the tree planting study. And they were conducted 9 years apart. Different study areas. So one was a regional study, and one was a city study, and the city wasn't even included in the region. They had different measures of tree loss and gain, and they used different statistical models. Nonetheless, despite these differences, we found that losing trees was associated with increased cardiovascular mortality, whereas planting trees was associated with decreased cardiovascular mortality. So you have this symmetric effect. Also, both studies found a dose-response relationship between trees and mortality. They were expressed in different ways, but in the EAB study, as more trees died, we saw more people die. So that's a dose-response relationship. More tree deaths, more people deaths. And in the tree planting study, as trees age and grow, they were associated with bigger reductions in mortality. So trees get bigger, the impacts on human health get bigger. So a dose-response relationship. Now, for those of you who aren't scientists, the consistency of these results may seem like no big deal, but let me tell you, from my experience, it's quite remarkable to do two different studies like this and find consistent results. And I think what it tells us is these studies taken together really strengthen the evidence that trees may be associated with reduced mortality and in particular with reduced cardiovascular mortality. Now, because this study focused on a specific action, that is planting a specific number of trees rather than, say, using a satellite measure of greenness, I was able to do a cost-benefit analysis. Remember, I am an economist by training, so I can't really help myself. I want to do, bring the look at cost-benefit when I can. So specifically, we evaluate the costs and benefits of planting one tree in each of Portland's 140 tracks. To do that, we made two assumptions. First, based on a 2005 study, the average annual planting and maintenance cost of a tree was $58.70. And we'd adjusted for that for inflation. So that's what it costs for 1 year. And we multiply that by 140, so we get the costs of planting and maintaining 140 trees, $8,218. Okay, well, that's easy enough. The cost side's easy. What about the benefit side? How do you put an economic value on saved lives? Well, it turns out the EPA does this all the time. So, for example, they may be evaluating a new law that might have stricter air quality standards for energy, for the energy industry. And those stricter standards may impose costs on the industry, but they may also estimate that they would save lives. So they have to be able to compare the two. And they've done a lot of work on what's called the value of a statistical life. That is, how much people are willing to pay to save one anonymous adult life. And I won't go into all the details of that, but it's pretty strong science. And what they come up with is that one anonymous adult life is worth $10.7 million. Now, our model, there we go, there's the 10.7 million. And our model showed that planting one tree per census tract is associated with 1.33 fewer deaths. And that corresponds to $14.2 million. So it's ridiculous. $8,218 in costs, $14.2 million in benefits. That's a benefit cost ratio of tree planting of 1,727 to 1. Now, even those Nigerian email scams we used to get didn't offer those sorts of returns on investment. Okay, so I've bombarded you with lots and lots of graphs and numbers and everything. What's the take-home message? What does it all mean? Well, hopefully I've shown you that trees can, quite literally, be a matter of life and death. And they also provide benefits throughout the life course, from before you were born, so the birth outcomes, all the way to extending a person's life. And I've done research showing that exposure to trees is associated with improvements in other health outcomes throughout life. So asthma, childhood leukemia, ADHD, surgical recovery. So it's not limited to the beginning and end of life. The health benefits are throughout people's lives. And that's just my work. Research from other scientists have shown an association between tree planting and an even wider array of health outcomes, including several mental health outcomes. So the health benefits of trees, we're only just scratching the surface here. And these benefits, as I've shown you, are provided in a highly cost-effective manner. Human life is valuable. Healthcare is expensive, but trees are cheap, relatively speaking. So if you think about the budget of a hospital in the city you live in and compare that to the urban forestry budget, the hospital is going to have orders and orders and orders of magnitude more money. And also people would think of them as being very separate things, but they really shouldn't be. As I said at the beginning, I think we should be thinking of trees as an essential part of our public health infrastructure, and we should be funding them as such. Finally, and people don't get this point sometimes, trees are an easily modifiable part of the environment. You can plant them in most urban settings. For example, if we found that living next to a national park was good for you, I would almost certainly imagine it is. What would that mean from a policy point of view? We can't just move everybody to the edges of a national park or start putting national parks in cities. It's not possible, right? So it's of limited policy relevance. But tree planting, that is something we can do in a range of settings, virtually every setting. So it's highly policy relevant. Trees are a modifiable part of an environment. And I think once you start accounting for the health benefits of trees, it's clear that the benefits of any tree that's planted in a reasonable location, not something really goofy, but any reasonable tree planted in a reasonable location in an urban area, the benefits will far, far exceed its costs. We've, in the last decade or two, there's been quite a few models. iTree comes to mind in particular, where these are accounting models where you try and come up with a benefit cost ratio of trees. And they've been extremely useful at helping people show the benefits of trees. But as we start to understand the health benefits, I think they've become redundant. We really don't need to do that anymore. We're past that. Get the trees in the ground. It makes economic sense in every reasonable situation you can imagine. Just stop it. Stop it. It's not necessary. It also means that maintaining mature canopy is extremely important. So that is what I have for you. Here's my contact information. I'm happy to answer questions now, and then happy if you have other questions to email me. If you look at my website, I have a few things that might be of interest. I have 5 different fact sheets that cover different benefits of trees, including one on the health benefits of trees. So feel free to use any of the resources you see on that.